We'll be talking about social determinants of health, APOE, and cognition. And mainly, I would like to describe the way that I use the GAAIN platform to fuel an idea of a current project that I'm working in. So first, I will speak briefly about the background and motivation of the current analysis, the ways that I have been using GAAIN to inform the research that I'm conducting, some of this exploratory analysis that I conducted using the GAAIN platform, and some preliminary result of the emerging project that born from the GAAIN analysis. So first of all, the APOE gene is one of the most famous genotypes related to Alzheimer's disease, not just because of its dose response pattern, where the EQ allele offer some degree of protection, and contrary, the E4 allele increase the chances to develop Alzheimer's disease, but also because it's highly prevalent on the population, and it's involved in several mechanisms of the pathobiology of Alzheimer's disease. So there exist different genetics components that eventually can moderate the expression of or moderate this relationship between the APOE4 and late life cognition. Some genetic components can reduce the risk, other ones can enhance the risk of the APOE4, but also we have other type of variables who are much more social or environmental variables that eventually can moderate the effect of the gene. Race, for example, we have seen that the distribution of the APOE gene is not the same across different races or ethnicities, and even the effect of this gene is not the same. Lifestyle, as you might know, we know that potentially can be a strong tool to prevent late life cognitive decline. However, we still having certain degree of uncertainty about if the effect is also significant under these genetic conditions. But if we scale one step, we might see also these other variables, these social or environmental variables that make a person much more prone or less prone to, for example, be engaged on healthy lifestyles. These are the social determinants of health, which are basically the conditions where we live and people grow. And these are divided in 5 main social determinants of health: education, access, and quality, healthcare access and quality, the neighborhood and built environment, social and community context, and the economic stability. So recent studies have shown that these social determinants of health are highly related to several indicators of brain health and even of Alzheimer's disease or other dementia risk, showing that the condition where people live have a strong impact in the way that the brains develop and also their chances to develop Alzheimer's disease. Nevertheless, we are not clear yet if a favorable profile on the exposure to social determinants of health also eventually can moderate the expression of these genes or the effect that APOE2 or E4 have on the risk to develop Alzheimer's disease. So the first way that I started to use the GAAIN platform to inform this motivation to understand how social determinants of health eventually moderate the effect of the APOE gene on late life cognition was to select or see or search what social determinants of health have been measured in data sets who already measured the APOE gene. And I realized that of course, the most evaluated social determinants of health has been education, and particularly education years. So from this was very useful to have a landscape about what the database related to Alzheimer's disease that is stored on the GAAIN platform, what social determinants of health are they measuring. And also from this, I decided to perform a first analysis with the variable that has been more measured, which in this case is education. So far we know that education years offer a degree of protection against Alzheimer's disease. And the main explanation is the cognitive reserve hypothesis, which is basically state as you have more years of education, your brain have more resources to cope with the adversity of aging or the pathobiology of Alzheimer's disease. And even some systematic reviews and meta-analysis have stated that there exists some linear dose response where for every year increase that I have more protection. However, at the same time, more educated people also behave in healthier ways. And also, as I have more years of education, probably just for the fact that if I have more years of education, I can have a better job on a better position. Therefore, my exposure to social determinants of health will be lower. So from this started my first question. Does an increase in education year is always protective against RD, or there exist critical moments where education starts to be protective against AD, and how this relationship arrived by APOE carriers? So the main goal of my analysis was to assess the association between education years and AD by APOE allele. And I used 5 cohorts, 3 United States cohorts and 2 European cohorts. The inclusion criterion was the available information for AD diagnosis. Those were defined as the cases, cognitive normal as the control, education years, and the APOE allele. And I created 3 cohorts. The first cohort, which was the lowest genetic risk cohort, the APOE E2 carriers, the E3 carriers, which was like the neutral genetic predisposition, and the high risk cohort, which are the APOE E4 carriers. Regarding the covariables, I just included race, and because of sample size and to conglomerate people in 2 groups, I divided them white and non-white, race or ethnicity. And the exposure, I divided the exposure in 2 ways. When I had the 5 cohorts, I granulated the education years in 8 years or less, 9 to 12, 12, 13 to 16, and 17 or more. And in the US cohort, I just divided less than 12, 13 to 16, and 17 or more. Why I did this division? One reason was because you may notice that the number of people who have less than 12 years of education is not so much. So I needed more people to have more power for those groups. But also, as education is a socioeconomical construct, or is highly dependable of the place where I live, then I divided this education on 12 years, like marking like the end or achieving high school. And after that, achieving college or any other kind of degree. And I performed logistic regressions by APOE allele carriage, and using lower education level as the reference value comparing to the other highest levels to see if this dosage response patterns appear. So as you might have seen, the number, these are the descriptive statistics of the sample. Things to highlight, as I mentioned, the non-white people is just between 20% or 19%, and most of the people is 13 years or more of education. So that might be also to consider then for the size of the effect of the association that we find. So in this first exploratory analysis, I noticed that using the 5 cohorts, the people who have E3 for the APOE, there is no necessarily protective effect between those who have less than 8 years of education or those who have 12 years of education, but just the protective effect appears after more than 13 years of education. In the case of the APOE E2 carriers, the protective effect of education, or this boosting effect from this genetic component, it was observed just in those who have 17 years or more of education. In the other case, Even though this can be because of sample size issues, it gives you some clues about that maybe genes, in fact, interfere, or the effect of education is not the same across the different genetic components. And for the case of the APOE carriers, a similar trend with the APOE3 is observed. Those who have 13 or more years of education, we can observe that protection from education. In the other cases, we have an opposite trend. So then I conducted the same analysis, but as at the beginning, I thought, well, I'm combining a sample, some group of people from Europe and some group from United States, and educational systems are very different between countries, or in some countries of Europe, 13 years is finishing high school, but in United States, 12 years is finishing high school. So how much that effect also can be interfering on the results of the analysis. And in fact, for E3 carriers, those who have 12 years of education compared to those who have less than 12 years of education, they effectively have less risk to develop Alzheimer's disease. And here we can observe that those respond pattern. However, for the APOE2 carriers, or in this case, we can observe that those who have 13 or more years of education, they present some degree of protection. And in the case of APOE4 carriers, we observe the same trend. The protective effect, it's achieved once people have 13 or more years of education. So this first analysis was very informative for me to understand that maybe there are some effect of the social determinants of health here, and that the way that the determinants of health interact with APOE gene will vary according to the alleles that people carry. So from this study, we decided to start to conduct a systematic review to evaluate how social determinants of health moderate the degree to which APOE allele carrier develop different cognitive outcomes. We included quantitative studies, including analysis by some APOE allele, measuring some kind of cognitive outcome, and using as exposure at least one of the 5 social determinants of health. We included the studies in native language, published up to July 2020, and from an initial sample of 11,000 articles for screening, now we have 146 articles for inclusion. So I would like to show you the first preliminary result for the first 100 articles that we have extracted. So the comprised population included at baseline in all the studies, it's a total of 253 people, with studies who range from 23 people to 61,000 people in a study in Denmark. 23 studies describe the number of APOE2 carriers, and 94 studies describe the number of APOE4 carriers. And as you can see, most of the studies are located in the United States, some of the studies in Canada, and some other places from Europe. Regarding the social determinants of health who has measured as exposure, 75% of the studies measured just one social determinants of health as exposure. And of course, following the tendency that we observed on the GAAIN platform, most of the studies measure education access as the main exposure. However, we also have been observing other studies who evaluate the effect of neighborhood or economic stability or even social and community context. Regarding the terms who have been most studies, we've seen that education years appear like the most frequent, educational attainment, but also we observe other very interesting such as neighborhood, air pollution, work status. Regarding the race ethnicity, most of the studies include white people, and the other half, or 25%, they do not specify the race that they were including. Most of them also include older adults, although some of them have evaluated the effect of social determinants of health in children, APOE4 carriers, which is, I think, is something very interesting. And most of them also include healthy people at baseline. And regarding the type of outcome who have been measured, most of the outcomes have been cognitive or overall cognitive performance, multiple cognitive functions, and 17 articles also have been measured brain biomarkers such as amyloid beta burden, brain volume, or brain connectivity. And regarding the type of gene social environment analysis that have been performed, 93 articles, or the overwhelming majority, have measured the effect of the exposure of one of those social determinants of health in carriers of the APOE4 allele. So, as for the discussion, this first analysis was very informative to move this idea forward, to think about, it's just the effect of education itself, the ones who provide the protection, or is the fact that as people who achieve school or achieve university level education, they are also exposed, or they are already exposed to an environment to proposing them to the fact to being able to finish, for example, university, or to have enough money, for example, to pay for university education. So we started to question a little bit this notion of this linear dose response of education, but maybe there are some crucial moments to show when education is effectively protective. This first analysis was very useful for us to understand that we can combine maybe multiple places in terms of the effect of social determinants of health, because the way that every social determinant of health affect people will vary according to race, ethnicity, societies, or cultures. So it's something that we need to consider. And also, we need to take attention to the fact that on these studies, we have observed that there is underrepresentation of people with 12 years of education and less, and different races and ethnicities, which are often more exposed to social determinants of health. So finally, yes, through this analysis, we found that effectively, there is some trend that the social determinants of health or the effect can vary according to the APOE genes. And if this effect is a reflection of multiple social determinants of health, well, this is something that we would like to figure out with the project that we are conducting right now. Thank you so much. And thanks a lot for your invitation and for this wonderful platform.